When you find out your child is self-harming or is feeling suicidal or has a plan or has made an attempt, that is the hardest thing to do, is to stay calm in that moment and get curious to say, wow, that must be really hard. Can you tell me more about what's happening?
Welcome everyone, this is Ekaterina with Trust Me Mom. Today I'd like to introduce you to Wendy McSparren, who is a clinical social worker. Wendy, can you tell us a little bit more about your experience and background?
Yeah, I'd love to. Thanks for having me. So I have been a social worker specializing in mental health for the last 36 years. 24 of those have been in private practice. I was a solo practitioner prior to launching into group practice, which happened during the pandemic when there was such a huge need for mental health services, and I just couldn't keep up. So at that time, I started to expand, and we are at 15 clinicians now in our practice here at Westmoreland Psychotherapy Associates, and still growing.
Wonderful. That's amazing. So can you tell us more about what even inspired you to pursue psychology in the first place?
Yeah, it's funny because in college, I actually was an accounting major my first 3 years of university, and I didn't like it. I couldn't stand it. And I did really well in my psychology classes. I also did really well in the business marketing classes. And I met with a psychologist who did some testing with me and said, accounting is not your thing. You're a people person. You should really focus on working with people, and psychology would really be the thing that would work for you. Mm-hmm. And so I switched my major my second semester junior year to psychology, did very well. My senior year, I was encouraged by a mentor to apply for the social work program at the University of Pittsburgh. And I did, and I loved it, absolutely loved it. And I think it really fit for me because honestly, as a teenager growing up, I had a lot of issues. And I think what's inspired me is I want to give hope to people that you can have struggles and difficulties in life, but there's hope and there's light at the other end of the tunnel.
Right. It almost feels like you helped yourself first, mm-hmm. and now you're helping other people. So let's talk about how you can help parents of difficult children. As if every child is easy or difficult, but I would like to talk about very challenging subject, mm-hmm. very sensitive subject today, which is depression and suicide in kids.
Yeah.
So let's unpack it a little bit. So let's start first with even identifying, because a lot of people will say, oh, I'm so depressed. So what actually depression is? Mm-hmm. And also I'd like to talk about different aspects of child's behavior and how to help them.
Yeah. I mean, adolescence is such a difficult time, and in life, we do manage real ups and downs that are part of, just experiencing emotions, good emotions, hard emotions. And, so there is a little bit of a difference between being clinically depressed versus situationally depressed. Mm-hmm. There can definitely be situations that really impact you and you feel sad, you feel depressed, and it can be for a period of time. It may or may not be a clinical depression. A clinical depression really tends to be something biologically related, where perhaps you might benefit from medication, maybe not. Therapy also could be very beneficial without medication, especially with kids and adolescents. Their bodies are still growing. So making those decisions about, do I put a child on medication or not, is a really hard thing to decide as a parent, right? Mm-hmm. Will it help? Won't it help? How will it affect their growth and development? But kids, when they're depressed, they can look different. Sometimes they can look really angry. We might think about depression just as sadness and isolation. And that definitely is a sign and symptom of depression. But anger and irritability can also, especially in young people, be another sign of depression. And suicidal thoughts, my experience in doing this for as long as I've been doing it is most people have different degrees of thinking about what would life be if I wasn't here, right? Would anyone miss me? Life is so hard. I wish I wasn't here and I didn't have to deal with this. To the point that they may be thinking about plans, or maybe they actually have made an attempt. And that's a little bit different than kids who are engaging in maybe non-suicidal self-injury. That's a little bit different. And that is something I see a lot with young people in our practice, is they may self-injure and they may be feeling suicidal or they may not be, but sometimes that can be a precursor to them experiencing suicidal thoughts and plans and behaviors.
Wow. So let's talk about the injury and self-harm first. What causes? Obviously, there are different reasons, and typically a child is distressed.
Yes.
So can you tell us more about what leads to that behavior? Is it that they are suffering so much emotionally that they're trying to apply pressure to their body and take that pain away? Can you explain it more?
Yeah, I think it's different for different kids. For some kids, they just have this build up and they need that catharsis. They need a release. They need to get that out because it just feels like a volcano that's going to explode, whether the emotion is anger or sadness or loneliness. For some people, it is that catharsis and release of those built up emotions. For other young people, sometimes the self-injury, when our bodies get injured, if we cut our finger, our brains release these chemicals as a protective mechanism. And so you don't always feel the pain initially, right? Because you're having a rush of dopamine happen in your brain. And so some people do it because they get a good feeling from it. Because of how our bodies work and how our brains work to protect us. So different kids do it for different reasons.
And then they develop that positive reinforcement
That's
loop.
right. That's right. Yeah.
But then what leads to that build-up?
Mostly emotional distress. They don't know how to handle their emotions about a situation, whether it's with peers, within their home. Some of what's going on in our world can be really overwhelming. So hearing things in the news can be really overwhelming for them. And they just don't have we call it distress tolerance or the emotion regulation skills to really cope with it. And that becomes the way they cope.
I see.
Yeah.
And do you see any difference with general population and then maybe kids with certain disorders or special needs? For example, will, let's say, kids with Asperger's or any other neurodiverse condition predisposed to have depression and self-harm, or it's pretty steady across the population?
Any young person is at risk for this. Kids with depression typically self-injure more, but even thinking about young people who are on the spectrum, for example, I think about kids that I've worked with that are a little bit younger, like school age. They might headbang, they might bite themselves, they might engage in that kind of behavior before they're engaging in cutting or other serious kinds of forms of self-injury.
And what should parents do if they notice their child behaves this way?
Yeah, this is so hard because when your kiddo is suffering, you just want to fix it. And sometimes you just want it to go away. There's a whole lot of feelings that come up for parents in all of this. And I think the biggest thing is to stay calm and get curious about what's happening. And when you find out your child is self-harming or is feeling suicidal or has a plan or has made an attempt, that is the hardest thing to do, is to stay calm in that moment and get curious and be empathize to say, wow, that must be really hard. Can you tell me more about what's happening? Right? I think the other thing parents need to do is get a professional for their child to be evaluated, but also for support for themselves. Because there's just so many emotions that come up as a parent. You can take it so personally. What did I do wrong? How should I have been handling things? And sometimes we get mad and frustrated and we say, snap out of it, because we're human too, right? We're human too.
Right. So can we do a bit of a role play with,
sure.
Let's say I noticed my child is cutting herself or does some kind of self-injury. It's very hard for me to stay calm, but basically your advice is to say, oh, I noticed this is happening. Can you tell me more about how you feel? So give me some literally scripts to talk to my child.
Yeah. I mean, I might say, so if you were my child, or even an adolescent coming to therapy, I'd be like, oh my goodness, what happened to your wrist? Nothing happened. It's none of your business. It's like, oh, sweetie, something must be going on. What's happening? I think what's happening is a key question to ask. We so often ask in our culture, what's wrong? What's wrong? And think about how that feels when I say that to you versus saying, what's happening right now?
Right. What's happening is more neutral. It actually invites you to share the situation.
Yeah. Versus what's wrong, because kids hear that as what's wrong with me, and they get defensive automatically. So I think as much as you can take a deep breath and say, oh my goodness, what's happening? What is happening?
And if they say, I don't want to talk about it, or nothing, then what's next?
So I would probably say, I know you might not want to talk about it right now. We need to talk about it. So, could we talk about it this afternoon?
So what I just detected is we're not saying, share with me when you're open or ready. It's more, we need to talk about it. So you take control of the situation. You're stating that we will address it, whether you want it or not, and then you're offering a potential time frame for
Correct. That. Right.
Okay.
Right. Give a little bit of control to your young person too. But you as a parent need to say, well, we have to talk about it. Right. It's not an option for us not to talk about it. I have to understand.
Okay.
Right.
And then you mentioned that it can be caused by their peers' pressure, overall world situation, or parents. So in this case, if it's already very turbulent at their home, they probably would not be suddenly trusting mom or dad who's been aggressive or abusive before to share with them.
Right.
And it's more of an education for parents to change their perspective and address the situation. So if some of the people recognizing themselves that, yes, it's been a lot of conflict in the family, that maybe they're going through divorce, maybe they're going through something very challenging, and parents recognize they've been turbulent themselves. So how can mom or dad address the situation? Because this is a very scary sign.
Very scary. Yeah. One suggestion would be, if you can't talk to me, let's identify somebody you can talk to. And it could be a family member. It could be, I'd like to get you into therapy if the family is open to therapy. It could be maybe somebody within the school system, because lots of times there's school social workers, school psychologists, there's SAP teams in schools. So, and the school might notice some of this before you even as a parent notice it, right? So I think it's getting your young person to talk to somebody.
Okay.
To somebody.
But someone you trust, not a peer who is already doing drugs.
Right. It wouldn't be a peer. It would be who's a trusted adult or young adult, because you might need somebody like a cousin who's in their 20s that they look up to, right? For them to feel safe to talk to them.
Okay.
Yeah. I wouldn't necessarily be a peer, because sometimes, and I remember this analogy, when our peers are struggling and you're struggling, it's like swimming out to a drowning person without a buoy, and you're trying to save them and you both drown, right? Yeah. So I would get a trusted adult or young adult, that they would feel safe talking to, so that you could get some information out of them.
What about any organizations? So I know on the positive side, there's Make-A-Wish, or some organizations that come and create this amazing experience for kids or people. is there, besides suicide hotline, are there any organizations that a child or a parent can reach out to for support?
There are definitely supports for parents, and I think I provided you a list of those supports, so we can maybe list those in the show notes. And I think, looking for after-school programs would be helpful. If people are involved in their faith, it could be faith-based youth groups that might be helpful. Social media is such a mixed bag of nuts for young people. And I know there's a program called Dashtrum, and Dashtrum is it's new, and they're going into schools to do, get kids off screens and get them out doing physical activities, but it's almost like challenge by choice. You're taking them out, you're outside, they're learning skills to problem solve, to cope. And this is a program that is in the startup at Alpha Lab right now, and they are reaching out to parents, and they teach coaches how to run these kind of programs. And some of the early feedback they're getting is really great, that kids are loving it because it's getting them out. They're being physical, they're interacting, it's playing and learning.
Right. And it almost, I begin to think about what you mentioned, that kids may feel lonely. And that's one of the ways we are social creatures, right?
That's right.
So for them to connect with the community, that could be really helpful as well.
Yeah. Yeah.
So what causes that loneliness? Because I want to approach it from an angle that, from my understanding, somewhere around age 12, the environment and peers begin to matter way more than parents.
That's correct.
And even if mom says, you're my sunshine, you're my love, you're the best, you're the rock star, if kids don't get that approval from their peers,
that's right,
they will feel miserable. So what can parents do within their influence sphere to help support their child? But at the same time, if they recognize that kids are not accepted by their peer group, how can parents aid and help in this situation?
So it's an excellent question, because the peer group thing is just, it's so important to their development, but it's such a double-edged sword, right? When kids don't approve, and they might tease or they might bully. I think the hardest thing for parents is to listen, just listen and not try to fix it. And to empathize about how hard that is. And then try to maybe encourage exploring some alternatives. Because there are kids who don't fit into, the norm in public school. And, I'm happy personally that we have alternatives to education for kids, because public education isn't right for everybody. It's just not. But exploring other experiences, whether it's, some sort of physical movement. I think you had shared with me that your daughter's doing Taekwondo, and what an empowering activity for kids, because that really teaches you physical discipline and expression, dance, gymnastics. There's lots, moving their bodies helps them learn to regulate their emotions.
I see.
Yeah.
Okay. So basically physical activity will be really important.
I think so.
And then but there could be two things. One, the community that comes with it and camaraderie. Let's say they're on a dance troupe together, or at the same sports team. Or it could be more individualized approach, where they're still moving, but they do not have that community. So will the most beneficial be where it's group support plus physical activity, or you think it's, again, case by case?
I think every kid is different. There are some kids that are very introverted, and the social thing doesn't help them. It doesn't help them. The stimulation may overwhelm them from, an auditory or tactile standpoint. And so, I think I had said this to you before, kids don't come with a manual, and every kid is individual. So you really have to kind of figure out your puzzle of your child.
Yeah.
I think that's really important, because there are some kids just that the group thing would not work for them.
Wonderful. Thank you so much.
Yeah, thank you.